Hi, my name is Beth Thorpe, and my social topic is dual diagnosis and chemical dependency. Dual diagnosis means that you have one or more mental health disorders and a substance abuse issue. These mental health disorders can be anything from bipolar, schizophrenia, PTSD, anxiety, major depression disorder. As long as you have one or more mental health disorders and you have a substance abuse or an alcohol abuse problem, this means you qualify under the dual diagnosis term. Dual diagnosis patients need a different kind of treatment. So rather than helping the addiction separate from the mental health, for dual diagnosis, it's best for specialists to treat the addiction and the mental health together. And that supplies better outcomes for people with dual diagnosis. So for me, dual diagnosis has affected my life. I was diagnosed in my early 20s. I have bipolar 1, PTSD, anxiety, and major depression disorder. And I used to be highly addicted to drugs. And later I became severely addicted to alcohol. I have been in alcohol and drug treatment for the last 6 years, and because of my treatment and the specialists that I work with, I have personally learned how to manage this disease for myself with a team of mental health and addiction specialists. Excuse me. So some of the solutions for helping people who suffer from dual diagnosis. So there are resources around mental health and recovery, such as NAMI, which is a great resource actually for friends and family of the suffering addict. NAMI will help you understand addiction and mental health and help you support yourself while you support your suffering addict. There are AA and NA meetings locally all over the world, and AOD outpatient treatment. I go to One Community Health. This is a great place that offers outpatient treatment for dual diagnosis and chemical dependency. There's also a place in Sacramento called the Sacramento Mental Health Urgent Care Clinic, MHUCC. They supply all kinds of services and resources, not just for mental health either. Like if you're struggling with housing or any other kind of social issues, financial issues, mental health crisis, anything, you can go to this urgent care and they can help you with treatment. They can help you with hospitalization. They can help you with getting resources and getting into a facility that offers treatment for whatever mental health crisis you might be going through. So it's just a really good place that can help people, especially with dual diagnosis and chemical dependency. Evidence that supports my solution. So I talked about One Community Health. They have a great alcohol and drug program along with alcohol and drug counselors. I've been with my alcohol and drug counselor for the last 6 years. She's amazing. She's my rock. They offer psychiatry. My psychiatrist, I've also gotten through One Community Health. I've been with her for about 3 years, and she offers me medication management and support. And we also talk a lot about coping skills for my mental health and just navigation on how to move forward in a healthy manner. They also offer peer support advocates who are basically people with a lot of lived experience. They can also offer just a listening ear and resources. They also offer therapy, which could be talk therapy, EMDR, and other types of therapy. These professionals specialize in helping patients with continuous outpatient treatment. I also talked about NAMI already, but there's another group for people who are families or friends of people suffering from addiction and mental illness called Al-Anon. Al-Anon is kind of like AA and NA meetings, but for people who are not addicts, but have addicts in their life, and they want to be supportive and find coping skills and help. Who can implement who can help implement the solutions? So I have this website here, Substance Abuse and Mental Health Service Administrations. They have a comprehensive treatment plan that treats both symptoms of the addiction and mental illness. There's an article here of Managing Life with Dual Diagnosis. This source is credible as it talks about the right way to treat dual diagnosis patients and how they have a better outcome after treatment. And different people who provide these services are therapists, AOD counselors, psychiatrists, social workers, case managers, and peer support specialists. You can also talk to your doctor if you have any questions about how to seek these kind of resources and treatment. My counter argument and rebuttal is that people believe prisons already provide mental health and addiction treatment because it's the law. But the reality is that these prisons are completely underfunded and totally overcrowded, making treatment and recovery extremely difficult for these incarcerated individuals. If society wants a safer community and rehabilitation, we really need to give these inmates better substance abuse and mental health support. Conclusion. Dual diagnosis is a disease that affects both mental illness and substance abuse. Treatment can be AOD counseling, therapy, medication, outpatient treatment, and integrated treatment. There are a lot of barriers that keep these patients from seeking help. Some of these barriers can be internal shame, not wanting to reach out because you feel shameful. Barriers could be you have a job and you don't want them to find out that you're trying to seek treatment, so you don't seek treatment because you don't want to get caught. You could be a parent who suffers from substance abuse and mental health, but you could be scared about losing your kids, so you don't go seek help. So there's a lot of barriers that keep patients from seeking help. So there's a lot of people who go undiagnosed and untreated. And I just want to point out the unhoused individuals and inmates around the U.S. with dual diagnosis are one of the most vulnerable populations as they receive less support and less treatment and have less resources and teams that can help them. And this is my works cited page. All of these links have all the information that I provided in these slides today. Really great information if anybody wants to look for help or just to learn a little bit more about it. And thank you for listening to my presentation, and I hope you have a great day. Thanks.